A dental surgeon in Los Algodones, Mexico, gives a quick primer on everything about zygomatic implants.
The zygomatic implants is a process we need to do, or we can offer to the patient like an option. With the regular implants, we can do something permanent. We can offer an option. So why this happen? Well, unfortunately, sometimes the patient lose the tooth very early, and for some reason the patient don't do nothing. They start to use maybe a regular dentures. The patient wait a lot of time. Every year will lose bone, and maybe when the patient can afford, can start with the process, we check out, we take a CT scan, and we see like the remaining bone is not good. Sometimes we can do a bone grafting or sinus lift, but anyways, if we do that kind of procedure, it will be not possible. So it's because in that case, what will be the option? The option will be the zygomatic implants, to give you again the quality of life of the patient and to can have something permanent, to can chew, to can talk properly. The zygomatic implants depends of each patient. Unfortunately, if it doesn't have a good bone in the maxilla, that will be the candidate. But we need to check up about the condition of the sinus lift. We need to check up all the complete case. If maybe the patient they are taking some medication, well, we need to do a evaluation first, and then we take the decision if that will be possible to do. We need to give you some prescription of the patient before we start everything, and also we need to do some blood tests. We need to do some evaluation by the anesthesiologist who will be in the room at that day, because we need to see all the numbers of the blood test to see how is the sugar on a specific thing that doctor needs to know in case will be possible, or they are the patient on conditions to start the treatment. That time, or about maybe the days the patient need with us in the clinic, at least we're talking about 4 to 5 days at least. Why? Because the process will be done in one day, and at least in between 3 to 6 hours. But first day will be an evaluation about the case. We take the CT scan, we do the exam about the blood test, and we take the decision about if it will be possible or not. Then second day, we planning to start the process, or at morning we check out how is the blood test. That depends. Maybe the second day we start, or the third day we start the surgical process. Then we finish. They are in the same room, the prosthetic doctor, because the patient go home with something permanent in the mouth. We don't send the patient with nothing. We place the implant and we give the patient something to can eat. So that process takes another couple hours to take impressions. The maxillofacial doctor finish the implants. So at least in between the surgical process and the impression for the temporary plate, we're talking about at least 5 hours. Then when we finish, we check out the next day the patient to see everything's go good. Then next day, the 5th day, the patient can go home, or he can stay, will be better for us. About the cost, well, we're talking about the zygomatic implants. They are from Nobel Biocare. The patient with us in the clinic, we're talking about each implant, 2,800 for each one. And here's something very important. Sometimes we can do a combination. When I say combination, it's because sometimes in the front area we can place 2 implants, regular implants, and just on the back we can place 2 zygomatic implants. Sometimes that is not possible. We need to place 4 zygomatic implants, 2 in each side. The cost of the regular implant is 1,200 for each.
Got questions? We would love to hear from you in the comment section below. Tell us what else you want us to cover. And do not forget to share and like this video.